So before I go a little bit further into this, just to give you guys even a little bit more background, CoxHealth, we started a direct-to-consumer platform of telehealth back in 2014. We started that actually on the foundation of occupational medicine, so for work injuries. And I promise this will all make sense as we move down this path. But so we started doing that, work comp kind of lives outside of some of the CMS guidelines on billing. And so it was a really easy way for us to deliver care to a large manufacturing population that, some of those locations are up to 2 hours, 2.5 hours away. And so we, instead of having providers travel out and really not making good use of our own resources, we were able to start that platform, again, using occupational medicine. So that really set well with a lot of the employers in the area, but of course, they very quickly started asking for more services. And so they wanted the common urgent care direct consumer platform. And so middle to late 2015, we opened up that sort of direct to consumer common urgent care that I know many of you probably have, and or at least have seen. And so we started that really, though, again, just direct to employers as a benefit that they could offer. So we were, contracting with all of them directly. In 2017, we opened up our direct to consumer to anybody in the state of Missouri. And a lot of these schools in our area really, really liked that for their teachers to help reduce absenteeism and substitute costs and all of that. And then we had about 3 or 4 school administrators that reached out to us directly and said, well, how do we do this for the students? We really, really need this for the kids that are not necessarily always getting the care that they need. And so that's kind of where we started into this whole school-based telehealth realm. And so these are just some of the goals and benefits that we set out, which was very obvious, reduce the absenteeism due to health-related needs. We know that if we can get them treatment sooner, they can return to class sooner. Obviously, it will lower the district's expenses if they're not having to pay for substitutes. And we created a lot of design flexibility in how we do this. We'll kind of talk through different models, different setups, different situations that we have going on. So in 2016, we received our first grant from the Missouri Foundation for Health to start with 6 school districts. And so we began a pilot, and one of the interesting things that we'll talk more about in this.
Hey, Bridget, I don't think we're seeing your design view, and I don't think we're seeing your slides advance.
Oh, I'm sorry. Thank you for telling me that. I wonder. Problem is, how do I fix it?
You might want to stop share and then reshare.
Yeah, that might work.
Bridget, if you're operating off of more than one screen, you'll just need to make sure that you're sharing the screen that has the slideshow on it.
Oops. Hold on, let me just do this first. Let's try that. I feel like I'm going to screw this up again. Is that better?
Yep, we can. Yep, that's good.
Okay, thank you. Thank you for telling me. Okay, so like I said, back in 2016, we received our first grant to pilot our school-based telehealth. We knew that we couldn't just do this in the same way that we do direct consumer care, using a smartphone or something like that when you're dealing with children. In the pediatric population, obviously, we need a little bit more hands-on. And so we put telehealth carts in 6 of these schools, one building. They primarily chose elementary and middle school settings in each of those 6 districts. They ranged in size. Our biggest school district, probably Ozark, all the way down to probably, I'd say, Mount Vernon or Forsyth were some of the smaller school districts that we had. And then we also kind of piloted these two different ideas where, you know, we had a lot of the school districts saying our nurses don't have time to operate the equipment, to facilitate the care between the provider and the patient. And so that grant gave us the funds to supply 3 navigators. So half of the schools we did what we call school navigators on site at those schools to facilitate the visits, and half of them without. It was a 3-year grant. After the first year, we saw very clearly that without any sort of a navigator, we really weren't going to get any traction. The school nurses really just don't have time in their day. These interactions, these visits can take, you know, at a minimum 20, 25 minutes, but up to an hour in some cases, just to get a full history. If we're doing strep testing, all of those things, I mean, it just takes time, and the school nurse really doesn't have that time. And some of the schools that didn't have navigators, those nurses would come in early or stay late to conduct visits, but it really, there was the need, they just didn't have the time to do it. And so we went back and received additional funding to supply navigators at those full 6 locations. After that, we've continued to receive funding to help with the schools. So we've used the USDA distance learning grant, I'm sure many of you guys are familiar with, to supply equipment and supplies for our school districts as we've grown. And then we also partner, we're Children's Miracle Network Hospital. And so they have given us both matching funds, in some cases supplied navigators for us in school districts. They also have a prescription fund and a sort of a fund for actual visits for those who maybe are uninsured or underinsured. So to date, well, I shouldn't say that. By the end of this past school year, we had 58 school buildings across 24 districts. I know we've received another grant, and I think that's added 2 or 3 more districts. And then we currently have 2 more USDA grant applications out there, which will put us, if we get it, over 100 school buildings. So both excited and very nervous about that. So this will give you kind of a picture of our visit numbers. So again, in 2016, it was just, you know, in 2016 and 17, really, we just had those 6 school districts right then. And in 2018, we added probably about 10 more school districts, I want to say. And in 2019, that's kind of our current year picture. So that's our calendar year, so not a school year. And about 56% of those students were able to stay in the schools. So before I jump to the next slide, we have had interest from other school districts, and you'll see some slides in here about Nixa school district. They're a very large school district just outside of Springfield, and they actually reached out saying they really wanted an on-site clinic. I'm sure you guys get lots of, any healthcare providers here probably get calls from employers that say, you know, we want an on-site clinic. We want a nurse practitioner to work here, you know, all of our hours. And that's really great in concept, but if you've ever done those, you know that that nurse practitioner does, you know, a little bit of work. So it's just not the greatest use of their time. Even for employers that maybe have 1,000 or more, I mean, they're just not using those nurse practitioners to the fullest capacity. And so, so they wanted that. We said, well, we have a virtual option that might be more affordable for both you and a better use of our providers' times, because we have enough providers support multiple locations. And so Nixa actually, again, they wanted this for their employees, for their staff and dependents. They noticed that they were paying hundreds and hundreds of thousands of dollars to support their substitutes, and they felt like the vast majority of their absences were health related for their employees. And so they joined on, and they actually, now they have 4 navigators. And again, I'll get more into detail about some of that. So this is kind of just a a marketing piece that we have that I think is really nice to share. Our 2019-2020 school year kind of got cut short. So this was our first semester data. In Nixa, you know, they started opening up to students later. So that's why you see kind of a lower number of student usage. But 54% of those kids were able to stay in school. We, of course, have to still respect all the guidelines. If they have strep, of course, they need to go home. If they have a fever, then they have to go home. So we still have to abide by all those same school rules. And certainly we would as providers anyway. However, because they're so heavy on their marketing for staff and dependents, they had 321 visits and 84% of those stayed in school. Now, if you break out the staff from the dependents were closer to about 60% and the staff were at 90%. So just that. So they really, they've been able to share in their presentations that they have offset the expense of having this service on site and those 4 navigators by reducing their substitute costs. So they've actually paid all of that back to themselves, which was really amazing to hear. In MoNet, so since Nixa has kind of joined into that new goal of, well, we really want to, you know, reduce our substitute expenses. And if you know anything in rural America, subs are actually really hard to get. So not only are they extremely expensive, but they're difficult to obtain anyway. So in MoNet, they had 53 students, 66% stayed in school, 149 staff and dependents, and 88% of those stayed in school. So just wanted to share kind of this nice little piece that we have here. So we do more than what we call basic care. Again, most people probably call that urgent care type services, but we call it basic care because it's a little bit more, it's a smaller scope than what you would do to an urgent care, of course. We also offer speech therapy. We started off with 2 school districts, and I think we're at 5 school districts now, just starting last year. So that's really been successful. Again, you know, one school district came to us and they had a very large influx of students that need speech therapy services. They have a speech therapist full-time, but they were not going to alone be able to handle that influx. And so we were able to kind of supplement their services. We did have one school district recently that reached out and just said, we want you to do all of it. And so we're doing all of that virtually as well. We have our wonderful asthma care nurse practitioner here. And so we can, we have spirometry testing, and we have obtained grant fundings to get spacers out to all of those schools. And so we can do their kind of annual and intermittent allergy visits or asthma visits there as well. Of course, we have occupational medicine, and then we have our prescription fund. So those are kind of some of the services that we've brought to the schools as we've grown. Mental health is, of course, something that's been asked for a lot. And we are currently, well, we started a pilot late into this past school year, and then the school year ended early. So didn't really have a lot of good data to share just yet. We are going to continue the pilot this coming year. So we'll hope to have some better information on that. But every school is really begging for that. And so if you guys have those resources available, please use them for the students. In fact, the school that we started with, we had already planned to kind of kick off a meeting and start those preparations. And 2 days before that meeting, a student had committed suicide on their lawn. So it was rough timing, but it was just illustrates why it was so important and why it was so needed. So we're going to continue that, and maybe I can come back and share some of that information at that time. This is that basic care scope of care that we have. Again, we do have on-site strep testing. So we have a CLIA license that covers all of our school districts. So kind of getting into some of the variation in what we do. Again, some school districts have navigators on site. Some of them have, so they are Cox employed. and they work on site at those school districts. So they're really embedded into their culture, and they abide by all of their rules. They also, in their downtime, can help support the nurse to do things like temperature checks and Band-Aids and all of that. But there's a lot of paperwork that those navigators are working on, excuse me, things like all the consent forms, privacy policies, etc., collecting insurance. So that navigator will do everything from register, schedule that patient, send them over to the provider, conduct the strep testing, do vitals and all of that during the visit. And then you'll see some equipment, which I'm sure many of you are familiar with. They will operate that equipment to facilitate the visit for the provider. So we primarily use GEDMed devices. This is that otoscope and general view lens that you can see here. And then we have a stethoscope for the heart and lung sounds. And then that's kind of a picture of one of our cart setups. We do provide scales and height charts and all of that. We've got a little scanner on there you can see to scan in insurance information. And then there is a printer if they need to print any visit summaries off for those patients. Now we do have schools that don't have on-site navigators. We had schools that said, you know what, I think we can do this. Primarily some of the smaller schools actually, they felt like they could really handle it. They had enough people there to support the program themselves. And so what they will do, obviously those individuals are not getting access to our medical records system. So when they connect on screen, we have a group of hub site navigators that will do all the register and scheduling, but then that nurse or that, you know, whomever in that school district that has been trained will still operate the equipment. So they'll still do the stethoscope and all of that, and then they can do the rapid strep testing as well for us. So I have a couple employees that go out and do all the trainings, and they manage all of our navigators across the schools. So that is really a quick summary. I know there's probably a lot of questions, so I really like to kind of open it up for any questions that you guys have.
That's great. Thank you so much, Bridget. I know that there's a lot of interest in the school health. So Joe, did you receive any questions in the question queue?
I have. So the first question is a big kudos for Cox being able to secure the USDA DLT grant. And wondering, is there a place where we can view a sample telecommunication system plan required for that grant application?
Is there a place where we can do a sample, what did you say?
A sample telecommunication system plan.
I'm probably not sure I know what that means, but maybe.
So, and let's see, that was submitted by Teresa Wilkie. Would you like to unmute and maybe elaborate on your question a little bit?
Yeah, so I'm working with some folks, and they're kind of the medical providers, and I think it's a technical requirement, and it's just sort of, we're just hitting against sort of the IT technical requirements for that grant. Has this sort of telecommunication system plan, and it may be that you weren't involved in that part of it. So
no,
that,
I know what you're saying now. I'm with you.
Yeah, it's just that it's the very technical, right? Like, so the like talking about like from a layperson perspective, like kind of what you presented, like we're going to treat these kids and we're going to do this with it, and so that's going to look. But that back end piece, that's I didn't know if there's like a resource, because I know there's a lot of tech centers and resource centers, or if you've been able to see anywhere where there's people to help with that. That's all. Thanks.
Yeah, I think I could probably, get with you directly and help provide some sort of a sample. I do know in the technical portion of it, I mean, there's a lot of detail about what, the broadband connectivity there. And I know we've kind of dug through a lot of resources to get all that information. We also, we get sort of a letter of recommendation from this wonderful MU Rachel Mutrex's team. And so, you know, we get support from other areas to kind of explain our story and what we're in our narrative and all of that. We also have to get MOUs signed with each of the school districts that want to be on board. And they do provide the actual internet service for this. So we do run off of their internet service. We've set up a few different models from a technical standpoint. We're trying to move everybody onto a VPN, but some people are still in what we call a kiosk mode. It's very secure, which is great, but it's a little bit limiting in the kiosk mode. So we're trying to move everybody over to a VPN that gives us a little bit more flexibility. But yeah, there's a lot of technical detail, and you know, luckily, since we've applied for a few of them, we sort of kind of take the same information and then just re-update it to reflect kind of some of the changes that have happened from a technology standpoint. But I think I could probably just work with you one-on-one, or anybody in the group that is wanting more detail on what we've specifically submitted in that portion.
Perfect, thank you. Next question for you. Are the navigators all nurse navigators?
They're not nurses. Yeah, so good question. These are people that we've supplied training to. So we train them on the rapid strep testing. We give them EpiPen certification training, CPR, all your basic life support, how to operate the equipment. And then they really operate more in terms of a front desk person. So, you know, again, that registering, that scheduling, collecting, online collecting payment for their copays. So they really focus more on that. So they are not nurses. You know, what we've found in many cases, not all of our schools, but in many of those schools, there's a lot of mothers that, you know, their kids are entering into the school year and they've stayed at home with their children, and now they want to kind of get back into work, but they want to work the same hours as their kids. So it's really kind of perfect because